In a monumental stride forward, the Food and Drug Administration, FDA, has recently granted approval for the first-ever gene-editing therapy aimed at treating sickle cell disease. This hereditary blood disorder, predominantly affecting the Black community, has long been a source of debilitating pain, organ damage, and strokes, all stemming from a single mutated gene. The FDA's green light for two distinct treatments, exa-cel, marketed as Casgevy, and Lyfgenia, signifies a revolutionary shift in the approach to managing this complex and life-altering condition. Hope amidst the challenge. For the estimated 100,000 Americans grappling with sickle cell disease, the FDA approvals bring a glimmer of hope for a life free from the relentless affliction. Excruciating pain, organ damage, and strokes have been the unwelcome companions of those afflicted, with the majority being of Black descent. While the medical community, patients, and their families celebrate these groundbreaking advancements, the path to accessing these therapies is fraught with challenges, both logistical and financial. Obstacles to treatment. The optimism surrounding the FDA approvals is tempered by the reality of the challenges that lie ahead. The complexities of these gene-editing therapies manifest in various forms. A limited number of authorized medical centers, the intricate requirement for individualized gene editing or addition, procedures that some patients may find intolerable, and a staggering multi-million-dollar price tag accompanied by potential insurance obstacles. Dr. Stephen Grupp, chief of the Cellular Therapy and Transplant section at the Children's Hospital of Philadelphia, describes the achievement as practically miraculous, but emphasizes the arduous journey that lies ahead. Treatment landscape. The approved gene-editing treatment, Casgevy, is a product of collaboration between Vertex Pharmaceuticals of Boston and CRISPR Therapeutics of Switzerland. Leveraging the Nobel Prize-winning CRISPR gene editing tool, Casgevy aims to correct the genetic mutation responsible for the abnormal shape of red blood cells in sickle cell patients. Additionally, 𝗷𝗶𝗿𝗀𝗍 Lyfgenia employs a more conventional gene therapy method by introducing a healthy hemoglobin gene into the patient's DNA. Financial considerations. While the prospect of freedom from the complications of sickle cell is tantalizing, the financial realities loom large. Vertex and 𝗷𝗶𝗿𝗀 have disclosed price tags of $2.2 million and $3.1 million respectively for their gene-editing therapies. Considering the already substantial financial burden of living with sickle cell disease, which averages $1.7 million over a patient's lifetime, the accessibility of these groundbreaking treatments is called into question. Limited reach and accessibility. Despite the transformative potential of these therapies, their reach is severely constrained. The FDA estimates that only around 20,000 eligible patients aged 12 and older, with a history of debilitating pain episodes, will be able to benefit from these treatments. Beyond the borders of the United States, particularly in Africa, millions of sickle cell patients may find these therapies entirely out of reach in the near future. Technical and resource challenges. The journey towards gene-editing therapies involves a series of complex steps. Initially, patients' bone marrow stem cells are collected during hospital visits. Subsequent editing using CRISPR or gene addition is performed, followed by the infusion of these edited cells back into the patient after quality checks. This process requires specialized facilities, with Vertex and 𝗷𝗶𝗿𝗀 having limited authorized centers, further restricting the number of patients who can be treated annually. Insurance hurdles. The pathway to treatment is further complicated by the necessity for insurance coverage. The pre-approval process, which can take months, adds an additional layer of delay to the critical treatment timeline. Given that many sickle cell patients are covered by Medicaid, concerns arise regarding the financial strain on state healthcare systems. Unknown long-term effects. While the FDA panel concluded that the benefits of gene editing outweigh the risks, uncertainties persist regarding the long-term effects. The relatively short follow-up period raises questions about the enduring impact on patients. The permanence of gene edits in stem cells introduces an additional layer of complexity, as any potential genetic damage may persist indefinitely. Patient perspectives. Despite the challenges, patients remain eager to explore these groundbreaking treatments. 𝗷𝗫𝗃𝗀𝗃, a 19-year-old sickle cell patient, exemplifies this sentiment. Expressing hope for the Vertex therapy, she emphasizes the urgency of moving forward with it, illustrating the profound impact that these therapies could have on the lives of those affected. Medical centers' approach. Authorized medical centers face a daunting task in offering these therapies. The highly challenging nature of gene editing treatments necessitates careful consideration of capacity and resources. Leading medical centers, even if authorized, anticipate treating only a small number of patients annually. Dr. Charles Azar, medical director of the Comprehensive Sickle Cell Disease Treatment Center at Massachusetts General Hospital, underscores the need for caution, proposing a phased approach to ensure the efficacy and safety of these novel therapies. Conclusion. The FDA approvals for gene editing therapies mark an unprecedented achievement in the quest to alleviate the suffering of sickle cell patients. However, the road ahead is paved with challenges ranging from limited accessibility and financial considerations to technical and resource hurdles. As the medical community grapples with these complexities, the cautious optimism of sickle cell patients and their advocates persists, with the hope that the promise of these groundbreaking therapies can extend to a broader population in the future. Thanks for watching. Please subscribe our channel for updated research news and share it, and help us to grow.